As I'm sure you all know, our maternity hospitals make Ireland one of the best and safest places for women to give birth in the world. We have the technology and expertise in place to make birth a safe and rewarding experience. Just put yourself in our capable hands.
We have the technology, all right. But do we have the staff to actually talk to the women? Every year we lose more and more doctors and midwives. Nobody wants to stay anymore.
It is true there have been a few unfortunate incidents recently, but I can assure you we have everything under control. We have systems in place to ensure the safest option for women and their babies.
So we try and cram more and more women into overcrowded hospitals. Have you ever asked women what they want?
I'm not the bad guy here. I know that women want to know they are safe in the care of their consultant. We are trained to the highest possible level of medical practice. We'll monitor all aspects of your pregnancy and ensure that you get it right.
Birth should be the most natural thing in the world. I think women are very capable. All they want is someone to listen, to support them.
In our hospitals, all members of staff work together to find the most appropriate level of care. My job is to provide strong leadership and clinical oversight.
And throw the midwives under the bus, as usual.
It is important in our hospitals that all member staff are on the same page, singing from the same hymn sheet, as I like to say, and maintain their place in the system. Women. Women of Ireland, fear not. Fear not the pains of childbirth, the terror of the unknown. For we, the glorious obstetric consultants, are here to save you. Save you from your risky, unpredictable, pregnant bodies. Only we can know the dangers you face. And we will make your safety paramount. Women-centered care has its place, no doubt, but one only has to turn on a television or pick up a newspaper to see the fate that awaits all those who heed not to the voice of medical authority.
Days of old, when doctors were bold and did not wash their hands, the powers that be began, you see, to overhaul birth in these fair lands.
We started with those who could pay, then the state began to pave our way. Bright light of reason took hold in a season, brought science to the masses. Superstition was undone, birth at home was totally overrun. The role of the midwife eclipsed by the light of the medical classes.
Change sacred wells to white curtain cells. Now we reap what has been sown. No rounded stones, no family homes.
Giving birth can be done by women alone. Midwives are totally under our domain as we wage the medical model campaign.
The medical model is a very fine thing. Makes the consultant a virtual king. Accounts for every risk. Ensures nothing's missed. It's in the Constitution. Women obey the institution.
I decide when and where. Get them in on the clock. We will make you, we will make you, we will make you safe in our care.
I'll tell you. Do you hold that for a second? It's all right, it's clean. I just sprayed it with Milton. Be grand.
Okay, what's the big surprise?
I'm pregnant!
Oh my God. Oh, finally. Oh, Jesus. I love you.
Ooh.
I'm happy.
I know, me too. Finally.
We need to make an appointment. Let's get you seen to.
Oh my God. Okay, hold on 1 second. Calm down. Okay, it's 7 o'clock in the evening, so we'll take it nice and easy. I promise. I'll call into the GP in the morning. Okay?
All right. It's just that it's taken a long time, and after last time, I just want to make sure it's all okay. That you're okay.
I know. I was thinking about that too. Especially after last time. And I think we should take things slowly. But I'll call into the GP in the morning and get him to book me into the hospital. And we'll take it from there. But I'll tell you one thing, I'm going public this time. I really don't see the point of getting a consultant when you don't need one.
Do you think that's wise? I mean, I know things are tight with rent and everything, but I want to make sure that you get looked after properly.
Well, you don't necessarily get that from doctors, do you? Do you remember the consultant I had the last time? Michael, I've never felt so utterly disregarded. He didn't even look at me. He didn't talk to me. He didn't even treat me like a real person.
I know, sweetheart, but you can't let one bad doctor put you off all of them.
But that doctor, he didn't even cancel the next appointment after the miscarriage. I had to relive that grief all over again. No, thank you. No. The midwife, she was amazing, and that's what I want this time.
All right. You're probably right. The important thing is that you are happy and healthy, eh?
Thank you.
Yeah. Let's not get ahead of ourselves or borrow trouble.
Sorry, I'm misled my mum. But let's not tell anyone else, okay? Keep it to ourselves until we know everything's going to be okay. Please take a number from the kiosk by reception. Number 125, please proceed to window 2. Sorry, you're in the wrong queue. This is for registration. You want that clinic over there. Sorry. Can I? Oh no. All right. Is there somebody sitting there? Oh, it's for your husband. All right. Okay. He must be exhausted. I wasn't skipping the queue. I was just. Oh, okay. Great. Ticket 202. Fantastic. And I thought I got here early. Well, I suppose I won't be getting back to work anytime soon. Please take a number from the kiosk by reception. Number 127, please proceed to window 2. Sorry, that's the system, love. Let's get you registered and then we can talk. It's really strange being back here again. Waiting for them to tell me what I already know. But I've the start of a little person growing inside me. Oh, the smell of the place takes me back. The old paint, dusty paper, and disinfectant. I have a knot in my stomach. Oh, please, please, please let everything be okay this time. How many women have sat here before me, waiting and waiting, trying not to miss their name being called? Oh, I'm so nervous. This time I want someone who will understand how important this is for me. I mean, Michael's great, but he fusses. And my mother's always been tricky. So this time I want someone to treat me as a person and not just a number. Number 202, please proceed to registration. Hello? Busy day, huh? Sure, half of Dublin is here. I'm Fidelma, a midwife here. How are you? Good, fine. A little nervous, but I'm okay. Well, relax. We'll take care of you. Name? Evelyn Murphy. Date of birth? 3rd of July, 1979. Is this your first pregnancy? I did have a miscarriage a few years ago. Sorry to hear that. When was that?
August 2014. I was about 7 weeks along.
No subsequent pregnancies?
No.
Well, relax. We look after you. Date of last menstruation?
16th of July.
Are you married?
No, I have a partner.
Have you told your partner?
I have a course.
Just ticking the boxes. Any sexually transmitted infections?
No.
We're nearly done here. Any diabetes or heart disease?
No.
Religion?
None. What's that got to do with anything?
Sorry, ticking the boxes. Well, that's you registered. Let's get your weight and blood pressure and take a urine sample.
Will I be seeing anyone today to talk about my care?
You'll be in with a consultant and he'll go through it with you.
I didn't have a great experience with the consultant I had the last time. I was really hoping to be with a midwife. Can't I not just talk to you?
Of course you can. That's just the system. Everyone has to see a consultant first and they decide on your care path and based on your risk level. If you're low risk, you can stay under the care of a midwife.
Low risk? Risk of what?
Well, that depends on how you look at it. The female body is a mystery, totally rife with pathology. The consultant relies, you see, on their medical mythology. A new life inside can make your body unstable. That's why you go into this examination table. Risk doesn't take a full until after the baby is born. Proportionate or absolute, they match the statistics to suit. Any little thing can put you on the list. A pregnant woman is only this if your blood pressure's up and your blood pressure's down. You have diabetes or a bad ultrasound. Female body is a mystery, totally rife with pathology. From here to there, the consultant will search everywhere to find an excuse to put his skills to use. It's what women must endure. Any previous complications, forget it, he'd get you for sure.
Eva Murphy?
Here? It's Evelyn Murphy.
There's a good girl. Make yourself comfortable and I'll have a look.
Sorry, I didn't get your name.
Mr. McGovern. Right. Well, your blood and urine are perfect. Your weight is fine. Good to see women looking after themselves, although I do anticipate problems further down the line when mum is over 35 on the first baby.
We have been trying for 3 years since.
You know, a woman's fertility decreases rapidly from as young as 32. I do wish women would take their fertility more seriously. It places a tremendous burden on us, and there's only so much that we can do. At least you've kept your weight down. I wish I could say that for all my patients.
If I'm okay, then I can be seen by a midwife.
Oh, hold your horses. Given your age, and I read something about a miscarriage there, combined with your difficulty conceiving, makes me think that though you probably are low risk, I think I should keep a close eye on you.
But you just said that I'm low risk, so I can be seen by a midwife.
I do, of course, have the utmost respect for my colleagues in midwifery, so if that is what you want to do, then that is what we will do, for now. But your risk level can change overnight. And as such, it could be the case that consultant-led care may be the best course of action for you further down the line. So keep that in mind. Right, that's you done. Off you go.
Hi, Mum.
Hi, darling. How was the appointment?
Good. Everything's okay. I'm in pretty good shape for a lady of my age.
Oh, never mind that. How far along are you now?
I'm about 9 weeks. Oh, Mum. I'm afraid of getting too excited, though. I can't believe this is actually happening.
I know, it can be hard having lost a baby and waited so long for another, but the excitement will come. The important thing is to listen to your doctors and take good care of yourself.
I know, Michael keeps telling me that. I think he's more nervous than I am.
He does tend to fret a bit, but he loves you and wants what's best for you, and so do I. Tell me, have you spoken to them in work about putting you onto something less strenuous? It can't be doing you any good, traipsing around the country, not in your condition.
Ma'am, it's grand. I'm fine. Work is fine. I'm certifying buildings. I'm not making them myself.
My daughter, the engineer. I just think you work too hard. It's no harm to take things a bit easy.
Well, we've had this conversation before, ma'am. Michael and I have to pay the rent. Surely I'll be on maternity leave towards the end.
It's just that I worry about you. Please, God, soon you'll be up to your eyes in nappies and night feeds. Pay you back for all those sleepless nights you gave me.
Oh, thanks, ma'am.
Now tell me, what consultant will you be seeing?
I have an appointment with the midwife next month.
But won't you be seeing a consultant? If it's just a matter of money, I can help. It is my grandchild, after all.
Ma'am, you're great, and thank you, but it's not a matter of money. I just feel happier with the midwives. I mean, I think they're better at treating you as a whole person, and, you know, they look at you instead of burying his head in your chart.
But so many things can go wrong. You know that yourself. Wouldn't you be better to have expert care? I just want what's best for you. Did I tell you, your cousin Orla went private and she had a really good experience.
Ooh, who did she have?
I think it was a Mr. McGovern.
Oh, ma'am, I had him for the first assessment. I don't know. I wasn't that comfortable with him. I'm happier with the midwives.
Won't there be midwives there working under the consultants? I'm sure you could speak to them. You could even ask for a lady consultant. I know I would have preferred that had there been any back then.
Do you know what? Not every consultant is perfect. What about that guy up in Drogheda?
That's not fair. If you'd seen what I'd seen growing up, you'd be happy to have someone with proper medical training. Birth can be a dangerous thing. There was that young girl who died having the baby all by herself. It wasn't long after you were born. It was heartbreaking. I was so lucky to have proper medical care. I don't know what would have happened had I not been in hospital with you.
I'm sorry, ma'am. I'm sorry. What was it like having me? You know, you've never spoken about it.
Well, you know, I had my own disappointments before you came along, but we didn't really talk about that kind of thing back then. You were just expected to get on with it. But with you, it felt right. But I was very nervous, and your father, God help him, he wasn't any use even when he was around. So when the time came, I just went in by myself, and when I was your age, in the good old days, doctors really had their ways. First contraction, you'd be out of action, drifting in a twilight haze. Doctor would do what needed to be done. Nurses would bring you tea and a bun.
That's the way it used to be. Sorry it was hard when you had me. Now women have a say, not just listen and obey. I want a midwife for trust and support. The hospital should be a last resort.
There was many a soul had to go it alone, lying in a grotto on a bed of stone.
It's for me to decide who I want by my side. Women have choices, we must raise our voices. It's for me to decide who I want by my side. Women have choices, we must raise our voices. It's for me to decide who I want by my side. Women have choices, we must raise our voices.
There was many a soul had to go it alone, lying in a grotto on head. Baby is safest in a hospital bed. Well, I'm delighted to say your scan looks absolutely fine. Baby looks great. Everything is as it should be. How are you feeling?
Good, good. I feel like it's really happening now. Oh, I wish Michael was here.
Well, you're doing brilliant. Have you any questions?
I've been starting to get the stories, from friends and family, and I've been reading up about diet and exercise, but there's so much conflicting advice out there.
The main thing is to listen to your body. Eat well, but not for two. And be sensible. A little gentle exercise is fine, but no heavy lifting. And that includes hoovering, by the way.
No hoovering. I'm sure and tell Michael that. I know I'm going to be seeing you between GP visits, but I just wanted to ask you now, what should I be planning for my birth? I want to have a natural birth and I want to be able to move around, no drugs or anything like that.
Well, as long as there's no complications, there's a domino scheme here run by the midwives. You'll be seen by myself or one of the other midwives from the team, and we'll support you during labour and you'll be free to move around. And once the baby's born, as long as you're both well and healthy, you can go home within 24 hours.
Oh my God, that sounds great.
And one of the team will check on you both at home. Now let me get you booked in for your next appointment and scan.
I'm sorry, I've just one more question. Do I need to have a birth plan?
Well, it's early days yet, but there are examples of birth plans online. But keep it straightforward, nothing too complicated. We'll go through it with you and put it with your chart. Now, you might want to take into account that labour doesn't always go according to plan, so what you might like to do if an intervention is necessary.
Oh my God, like you mean a C-section or something like that?
Not necessarily. Most women deliver normally. It's just good to keep an open mind. It could be something like changing your mind about pain relief. It should be fine, but the important thing is to be prepared and know that we'll be here with you all the way along.
Okay. This looks lovely.
Well, it's very well recommended.
Fancy.
So,
This is lovely.
what do you fancy?
I think I'm going to be naughty. I think I'm going to have the steak.
I'm going to go for the salmon. So, do you think we can celebrate a little yet?
Oh my God, I really do think we can. It was amazing to be at the ultrasound. I really wish you could have been there.
Well, it sounds like it's worth celebrating to me. Love you.
I love you.
We're going to have a baby.
Oh, that's the plan.
Oh, is there anything you need? Vitamins, exercises, anything you should be doing to make it easier?
Oh, no. Honestly, Michael, the midwife said just sensible eating and a bit of light exercise like swimming and walking. Oh, and she said no heavy lifting. And that includes hoovering, by the way.
Okay.
You'll be able for that, won't you?
Aye, yeah, whatever you need. Have you spoken to your mother?
Oh my God, she was speechless for once. For once she didn't mention your promotion.
Oh, yeah, thanks, Bernadette. It's coming.
And she wasn't too impressed with the midwife. She thinks doctors are the real deal, but she doesn't get how much has changed. And she was on at me to take it easy at work.
Well, she's right. You should be taking it easier. Yes, I can take on more work around the house. I was thinking of painting the baby's room. You know that paint you can get? It doesn't give off fumes. And we need to get a breathable mattress for the cot your cousin Ola gave us. Here, I've made a list of creches for us to check out.
Okay, do you know what? Why don't we talk about this when we get a table?
Right.
Okay.
Okay, it's just it can be really hard to find a place. That's what the guys at work said. Some of them were on waiting lists for a year. If you're going back to work straight after maternity leave, we need to get it sorted. One lad said we should even be putting our name down in schools.
Oh my God, oh come on, we don't even know what we're having yet. Can we just enjoy tonight for what it is and not get caught up in to-do lists?
Okay. It's just, I want to do the right thing, be a good father and all that.
You'll be an amazing father.
If you say so. Do you want to order a drink or something while we're waiting?
I'd love a small glass of red wine.
Should you be drinking alcohol? Well, like the book I read said everything you put in your mouth is going straight to the baby. Shouldn't you be watching it?
Watching it? Watching it? I've gone to the GP visits. I've read all of the books. How many books have you read? One, half of one. Is that it? No, look. I'm sorry. I don't want to start a row.
Really?
I'm just fed up of every Tom, Dick and Harry telling me what I can and cannot have. And you know what? Half of it is pure nonsense. Waiter!
Well, you'd better watch out. You'd better think twice. There's lots of naughty things that you might think are nice.
I'm not a child, not public property. Don't you see this life is my responsibility?
Well, you have to think of the baby. Follow all the rules. 'Cause your body is a table.
Everybody sits and watches everything you do. Please give me the credit that I'll use my common sense. Having one within is not a capital offense. Trust me with my body, I haven't gone insane. I am not a vessel, I'm a woman with a brain.
Well, you have to think of the baby. Follow all the rules. 'Cause your body is a table.
Everybody says I'm watching everything I do.
But you have to think of the baby. Follow all the rules. 'Cause your body is a table.
Everybody sits and watches, everybody stands and questions, everybody jumps and judges everything I do.
No more blues for you.
What are you doing here? Is everything all right?
I'm not sure. I went for the scan and they said everything was okay, but then they sent me here because they wanted to check with Mr. McGovern.
There's our mum-to-be. You just take a seat. We'll see you in the day clinic.
Can you tell me what's going on? Why are you sending her to the day clinic?
As I'm sure you are aware, certain new guidelines have come in concerning how we deal with risk here. I'll be taking over the care of a number of these ladies.
Surely that doesn't affect Evelyn. She's been consistent all the way along. She's still low risk.
If I'm low risk, I'd like to be seen by the midwife still.
I wasn't entirely satisfied with her scan, and given her age, I think it warrants further investigation.
But her pregnancy is progressing totally normally. No risk markers. Check her notes.
As
I'm right here, you could talk to me.
you are no doubt aware, of course, that I am the highest authority when it comes to the women here. In view of these new guidelines, I will be taking over care of a number of these women. This is coming, and you need to be more realistic when managing the expectation of these ladies. Right, let's get started. First, there's assessments, then we'll take your pee.
I'm in for a trace, so there's nothing to see.
You just want me out of the way.
It's not like we have a say.
Hurry up, we've 100 more today.
Next down the hall.
Up the stairs,
Turn the left.
down the stairs,
Turn the right.
scan, blood, wait.
They don't really care about you.
Unless you sue. I think I'd like to keep you in for a few more tests. Nothing serious, you understand? Purely routine.
Hang on. What tests? What kind of tests?
There's no cause for alarm. There are no complications with your pregnancy at the moment. However, this can change. In fact, we won't know exactly what level of risk you are until after the baby's born. As a result, I think I should handle your care from here on out.
Hello? You still haven't answered my question. Do I have to go with him?
It's out of my hands. It's up to the consultant. They tend to err on the side of caution when it comes to risk. He's a good doctor. His job to look for problems.
But I thought you were meant to be on my side.
I am on your side. We're part of a multidisciplinary team. Look, I'd still be here to see you and to talk to you. I know this isn't what you wanted, but I'll have a word with Mr. McGovern and see what we can do.
Well, I guess I don't have much choice in the matter, do I?
You must be exhausted.
You've no idea how tired I am.
Well, how'd it all go? Everything all right, eh?
Everything's fine.
Well, that's good, isn't it?
Jesus. These appointments. I was waiting there for 5 hours. 5. And I had so many questions. But by the time they called me, I was so tired. I forgot everything.
Well, it's good that work are giving you the time off for this. I mean, you're getting paid for it.
The financial implications are not at the top of my list.
But it all went well.
The consultant, he doesn't even look at me. It's just straight down on the examination table. I really miss being with the midwives because at least they gave me a chance to talk and ask questions.
Yeah, I realise that, but he's a good doctor. He may not be good for a chat, but it sounds like he's giving the baby his full attention.
That's the problem, Michael. The baby is a part of me. He should be checking that I'm okay too. I tried to show him my birth plan. He didn't even look at it. Please, will you come with me to the next appointment? I know he'd pay more attention if you were there with me.
Evelyn, you know I'd like to go. There's nothing I'd want more than to be with you. But I told you that the boss is getting thick with everyone. There's no way he'd give me the time off.
Couldn't you just ring in sick just once? Please, Michael. I missed my name being called today because I was in the loo. If you were there, it would be so much easier.
But you mean I'd have to take time out of work? I wouldn't get paid for it. Things are tight enough, and with the baby coming, how am I supposed to swing it?
I'm getting worn out, Michael. Please, I can't do this on my own. I need your help. Do you not hear me? Please, will you come with me, please? Look, just to the antenatal class, okay? It's on at the weekend.
I'll go to the class, of course I will. And I'll look into coming to the appointment, okay? I'll pull a sickie if I think I can get away with it, all right? I tell you what, if I'm not at the next appointment, I'll definitely be at the one after. Eh?
Mummies and daddies to be. This delivery suite is where you meet your precious little bundle for the very first time. Our aim is to support you to give birth naturally, drawing on the tremendous resources of your own body to bring your child into the world. You and your little one will be well looked after here in this hospital. We'll be giving you information for everything you need on the big day. Have you any questions?
What about parking?
There's paid parking here, so make sure and bring plenty of change.
Will there be any classes?
Yes, there's classes on washing your baby and changing your baby.
I'm sorry, I meant breastfeeding classes.
Of course, breast is best. We run twice weekly classes, so you should catch one while you're in. But breastfeeding doesn't work for everybody, so we'll also run you through the full bottle sterilising protocol.
Will I be alright to go to the birth? I'll not be in the way.
We love to have the daddies at the birth. It's an amazing experience to watch your child come into the world. But remember, gas and air are just for mammy, so if you do feel faint, just sit down and breathe. We also have a natural birthing room which is available on request, but there's a high demand on it, so it may or not be available on the day.
Dalman, could I have a private word with you, please? Do you remember the birth plan we worked out? I tried to show it to McGovern, but he just brushed me off.
I did have a word with him, but a lot depends on what happens on the day. It should be fine. Just, you know, it's his job to be cautious.
Yeah, should the consultant know at least look at the birth plan?
I'm sure he has. He probably just hasn't had a chance to talk to you about it yet.
But, look, I wanted to have a natural birth, and the way things are going, I feel he's pushing me into something I don't want.
Look, let's wait and see what happens on the day. The best thing you can do is, once labour starts, stay at home as long as possible, and that way you can avoid any unnecessary intervention.
But how will I know what's necessary or not? I mean, he's not going to listen to me.
Evan, the consultant's professional. He knows what he's doing.
Well, so do I. I'm the one having the baby. I'd like a say in how I do it. Is there nothing you can do for me?
I'm sorry. It's hospital policy. My hands are tied. I'm supposed to support these women, but so many times my voice isn't heard. My job is to help them treat birth as a natural process, but now it's all about risk, and it's the consultant who decides. They say it's all for the best for the baby, but as far as I can see, it's what's best for the hospital. I can't do this anymore. I once was young and new, ready to make a difference, pull every woman through. Years passed, so little's changed. Slowly I realize no matter how I try, I didn't have the clout. So we keep wearing women down and pulling babies out. Midwives are minimized. We have become assistants in the consultant's eyes. Our hands tied by policy, second-class citizens in this theocracy. We'll never have the clout, so they'll keep wearing women down and pulling babies out. This is the way things are, and though we've come so far, this is the way things are. It does seem quite bizarre. He is the superstar. This is the way things are. Don't waste your time like me, waging a futile war against the powers that be. You just get through the day, keep your head down and do your work, collect your pay. You'll never have the clout, and they'll keep wearing women down and pulling babies out. This is the way things are, and though we've come so far, this is the way things are. It does seem quite bizarre. out what you're having?
Nobody tells me anything.
What do you mean? What do you want to know?
Or I feel like nobody's taking me seriously.
That's just the hormones. You'll be fine after the baby is born.
Suddenly I have this life inside me, but I seem to have disappeared.
Well, it's not really about you, is it, Evelyn?
Baby's fine, so they think I should be fine.
See, the baby's fine. That's the main thing. But how are you? Is your back hurting? Are you sleeping okay? I remember when I was pregnant on you, I found it really difficult to sleep in the last month, and of course I was tired and weepy, but that's normal. It's what we women have to go through.
I'm just an incubator for this.
Have you talked to Michael?
Yeah, I have. But he just doesn't get it.
He'll never know, he'll never understand. Orla said Mr. McGovern is really good. Why don't you speak to him?
I have, but he doesn't listen. He keeps saying this is normal, but this can't be normal.
That's why you have to listen to your doctors. There's a before and then an after when you're having a baby. And in between, you have to let the doctor do what needs to be done.
But I was so much happier with the midwives. You know, I felt like I was the one having the baby, but now I'm just invisible. And it's all about the baby.
Do you know what your problem is, Evelyn? You're selfish. You always have been. It's always been about you. Maybe that's my fault I indulge you too much, but it's time to cop on. You're going to be a mother, and one way or another, this baby will be born. So stop complaining. It's not about you. The important thing is that you have a healthy baby. So stop whinging and let the doctors do their job.
Your cervix certainly feels ripe. I'm just going to try this one simple procedure.
Ouch! Oh, God, Jesus! Oh, was that meant to hurt? What did you just do?
I just performed a simple procedure. It's a little trick we have for getting things going. Well, everything seems fine there, but on the balance of probability, I think things could get worse if we delay. Pregnancy is ripe with pathology, but, Miss Eva Murphy, you play your cards right, you could go home with a healthy baby today.
What? What? Oh, hold on 1 second. I came in for a checkup. I'm not due for another 2 weeks.
Better out than in, I always say. Don't you worry. We will bind you to a bed, blind you. Any complications we'll ignore them until the baby's ready to come out.
What? Excuse me?
I said we will find you a bed, mind you, do some evaluations and be sure the baby's ready to come out. Ah, good. No nail varnish. Could you remove your jewellery? We don't want any delays if we have to section you.
Section? Sorry. What the hell is going on?
I think it's best we proceed immediately. Right, let's get you started. You're on the clock from now.
Hey, what just happened to him? He was examining me. Did he just decide I'm to have the baby today? But I'm not due for another 2 weeks. Well, I want to go home. I need to go home. Michael! Michael! Where's Michael? Isn't it best to labour at home? It's best, yeah. So I can go home. I'll go home. Michael!
Jesus Christ, what is going on? Is everything all right?
The consultant wants me to have the baby today, but it doesn't feel right. Michael, just take me home.
What? Is it all right? Will they let you go home? Is it safe?
I don't care. I'll check myself out, even if it's against medical advice. Take me home.
What if something goes wrong? What about the baby? Evelyn, the consultant must know what he's doing. If he says we should go ahead, should we not trust him? This isn't the way I thought it would be. I really don't know what I should do. I can't risk losing the baby or you. What do I know about giving birth in this situation? What am I worth? You want to go home, I can't do it alone. I can't take the chance that I'd make the wrong call.
This isn't the way I thought it would be.
You're feeling scared, that's quite natural, but we are reliant on what's factual. They say you should stay, let's do it their way. If we leave now, what price would we pay? Let's keep our cool, play by the rules, follow their plan, we've no choice after all.
This isn't the way I thought it would be.
This isn't the way I thought it would be. This isn't the way. I've got to get the bag. I promise I'll be right back.
Just do what you're told. It will all be over soon.
But I feel like I have to push.
It doesn't matter what you feel. It's all for the best for the baby. Mr. McGovern will be here soon to do what needs to be done.
Please, just give me a little more time, please. Please, till Michael gets here.
Rules are rules. So what does it matter once you get to go home with a healthy baby?
Please, I feel like I'm nearly there.
It doesn't matter what you feel. It's up to the experts now.
Tick, tock, tick, tock.
Please, just a little more time.
Stop whinging and let the doctor do his job.
Tick, tock, tick, tock, tick, tock, tick, tock.
Sorry, time's up.
Lights, camera, action. I said action.
No!
There were fluorescent lights glinting off the sharp metal edges. Faces passing, mouths opening, closing, asking me, telling me something I cannot hear, I cannot see, because I'm underwater. And I cannot feel the soft weight of my baby settling into my arms. In the middle of all that screaming, crying, and here-ness of life, I looked at his face. I saw nothing. No joy, no fear. I was just another box to be ticked.
Of course, none of this ever really happens. We take good care of our ladies and ensure they get the best possible treatment. What you see here are the fears, the fantasies that women have. None of this would ever really happen.